Hi, this is Dr. Atkins. In this video, we're going to discuss the differences between balloon sinus surgery in the office and endoscopic sinus surgery in the operating room. Endoscopic sinus surgery, called ESS, is done under general anesthesia. Office balloons are done under local anesthesia. ESS requires tissue removal, but office balloons do not. ESS has postoperative bleeding, and there's minimal to no postoperative bleeding with office balloons. ESS requires packing occasionally, but office balloons never require packing. ESS requires a patient to be off work 5 to 7 days, but office balloon surgeries only require you to be off the day of the procedure. Postoperative pain after an ESS is variable, but there's minimal to no postoperative pain after an office balloon. Healing time for ESS is approximately 6 weeks, but office balloon patients are typically healed within 2 weeks. Can balloons be used during ESS? Yes, they can. This is called a hybrid procedure. In my experience, patients who have had a hybrid procedure done heal faster than ESS alone. How quickly patients return to work after a hybrid procedure depends on the extent of balloon usage during the procedure. Balloon use shortens recovery time. Even though hybrid procedures are less invasive than ESS, a moderate amount of tissue removal is necessary in these cases, and patients should plan to be off work for 5 to 7 days, just like for an ESS. To summarize, the least invasive to most invasive procedures are balloon-only sinus procedures done in the office, hybrid procedures done in the operating room, and then traditional ESS done in the operating room. When does a patient need ESS instead of balloons? The bones of the sinuses are very thin and can get infected. These infected bones can't be cured with antibiotics and must be removed by ESS. Other times, the amount and consistency of mucus in the sinuses is so great that mucus would not drain through a passage dilated by a balloon alone. A wider drainage hole has to be made with ESS. The other group of patients that need ESS are patients with nasal polyps. Which procedure do I prefer for patients? I prefer the least invasive procedure that will get results. There's no sense performing an invasive ESS when a balloon procedure would do just fine. On the other hand, there's no sense performing a balloon-only procedure on a patient that needs an ESS or hybrid procedure. A word about ESS. Many of you may know someone who's had an ESS before. Depending on when they had an ESS done or who did their surgery, they may have experienced severe bleeding, black eyes, horrible pain, or nasal packing with gauze. These things were typical of ESS done years ago when every sinus was cleaned out rather aggressively. Even though I have to remove tissue during an ESS, I try to gently remove as little tissue as possible to cut down on the above problems. ESSs by definition are more invasive than balloon-only procedures, but are nothing like the old days of ESS. Now to review the procedures. This is an ESS. On the left side you can see the patient's septum and middle turbinate. The middle turbinate is moved over, the ethmoid bullet can be seen, and the free edge of the uncinate process is seen here. The actual opening to the maxillary sinus is underneath the uncinate process where this arrow is shown. The uncinate process is incised with a backbiter, and then elevated, and then removed with a shaver. Once the uncinate is removed, you can see the natural opening to the maxillary sinus, also known as the natural ostia. By contrast, this is how a balloon procedure is done. On the left side, again, you can see the septum and middle turbinate. This is the free edge of the uncinate process, and this gray box shows where the opening of the maxillary sinus would be underneath the uncinate. This arrow shows the balloon, and this arrow shows the tip of the instrument that is used to guide the balloon into the sinus. The instrument is guided into the sinus. The balloon is advanced, dilated, and then removed. After removal, you can see that the uncinate process has been moved over. There's a wider drainage pathway underneath the uncinate, and there's been very little trauma done to the sinuses. I hope this was helpful. Thank you.